welcome everybody. I'm Dr. Swati Banerjee. So today we are going to discuss about a very important topic which we sometimes oversee and overlook: how to write daily notes, discharge summaries, and operative notes. See, before we start this class, you people all know that we are into an era of an increasing medical litigations. So, whenever there is a medical legal case coming up against a surgeon in the court, we all need to produce handwritten documentation, not the typed discharge summaries as we all give to the patient. So these is where stands the importance of well-written, legible daily notes, discharge notes, and operative notes. In case these notes are not legible, not properly written, then it always weakens a surgeon's chances. So now let's start this class. We will start with how to write the daily notes. The daily notes, you people already know, we follow a set protocol for writing the notes. That is, we follow the SOAP format. The SOAP format is the subjective, objective, assessment, and planning. So the daily notes serves as a written medical legal document that serves as a record of the patient's hospitalization. It must be completed on a daily basis and must be signed on all and every pages. And it should include all the events. Events meaning whatever is the chief complaint or the problem the patient has been admitted with. Along with this, any new event if happens during the hospitalization of the patient. Say a patient has been admitted for an inguinal hernia surgery. Suddenly you come to know that the patient has had a history of a fall, or the patient has developed fever, any kind of sepsis or urosepsis. So that is a new event which is occurring during the hospitalization that also needs to be documented in the daily progress notes. So, as I said, it includes the new and active patient health related events. It records the events on a subjective and objective findings, where you evaluate and assess each and every event and plan for each and every event appropriately. It must be legible. It must be legible and it must be signed along with the date and time written on each page. So the daily progress notes are written following the SOAP format. What is the SOAP format? The SOAP format is, as I have told, is the subjective, objective, assessment, and plan. Now, the subjective part with which you begin writing the daily notes is basically you ask the patient how the patient has been feeling. Either the patient will tell you, or you give leading questions to the patient about what happened in the evening, how the patient has felt overnight after the surgery, and in the morning. So, this is what the patient will tell you. Now, if you come to the objective part of the SOAP format, objective basically is what you are assessing, what you see the patient, you examine the patient, you assess the various lab tests or any radiological examination which you might have ordered during surgery or the day before. Any imagings, lab test, microbiological, biological, or pathological is basically your assessment. That is the objective part of the notes. And then comes the assessment and plan, which is the most important part. The assessment section of the progress note will deal with each and every problem, the problem with which the patient was admitted, and any new problem, as I have already explained. Each problem needs to be listed, and you have to give a differential diagnosis for the problem. For example, if there is a patient of a laparoscopic cholecystectomy, you are giving the first POD round, then you see that the patient has got a mild abdominal distension. The patient will tell you either she's feeling bloated or she has not been able to pass bowel. What you see that there is a mild abdominal distension. Now, what should come as a differential diagnosis in your mind? Is it because of the use of the opioid analgesic or a restricted ambulation that there is a mild distension, or there is any dyselectrolytemia associated, or there is a mechanical cause of an obstruction? So all these are the differential diagnosis which will be a part of the assessment. And thereafter, you would plan that what would you do to address this problem. For example, if there is a mild distension, you would plan to ambulate the patient more. Okay. So I have given you a sample of a post-operative progress note. Subjective, as I have told you, the patient is going to tell you how she is feeling. If she doesn't tell you, then you give her leading question. In our field, in post-op surgery round, basically it is the pain over the operative side. If the bladder and the bowels have moved or not, has she experienced any nausea or vomiting? Is she tolerating orally if you have started her on any diet? Is she taking the medicines, intolerance to liquids or solvents? And if she is ambulating, either with support or without support. So all these will form the part of the subjective. But the objective is you start with the basic. You have to examine the patient's vitals. You cannot skip it at any cost. The temperature, the heart rate, the respiration rate, the oxygen saturation, and intake and output. These things are very important. Even in laparoscopic surgeries like lap cholecystectomy or lap appendectomy, where we might tend to ignore these, but these are very important. For example, say if the patient has an associated comorbidity of a hypertension, you would decide looking at her BP whether you would now start her on antihypertensives or not. For example, you decide that you will not start the medicines till the BP reaches 130/80. So you need to check the vitals. Then you will come to the physical examination of the appropriate system. The abdominal examination, you would start with inspection, palpation, percussion, auscultation, as you all know. Along with this, you should always touch base on three systems, which is the cardiac, the lungs, and the extremities. The cardiac to hear the rate, the rhythm, any new murmurs, lungs to see if there are air entry or not, if the lungs is clear or not, and the extremities to check any kind of edema or ulceration, any sign of DVT, which is very important. Then you check the incision site. Incision site, generally, we do not remove the bandage on the first and the second POD because the OT bandage is the most sterile dressing. So, if there are no major concerns, we would not change the dressing for 48 hours. Now, suppose on your first POD, you are saying there is any kind of soakage, then that is a different issue. You would need to change the dressing and see, examine for any wound collection, look for any surrounding erythema. And then the extremities, as I have already mentioned, for any edema, signs of DBT. Along with that, a review of the lab studies and imagings if you have done. For example, as I have told you just now, given you an example, a patient of mild abdominal distension post lap chole, you would like to see her electrolytes. So you would assess all these things in the objective part of your daily notes. Now we come to the assessment and plan. You will give a brief statement of the overall impression and always include the POD you are examining the patient. So POD 0 is the day of the surgery. After that, POD 1, 2, and so on. So example, if the patient is recovering well but has a mild pain over the incision site. The plan usually, generally, comprises of the pain management. Somebody needs to switch off their phone microphone, please. Yeah. So, usually part of every plan would include the pain, whether you would continue the analgesics, whether you would like to switch over from IV to oral analgesics, increase the interval between the doses, what diet you would initiate, if the patient would require any physiotherapy or not. We always promote early ambulation of the patient. Now, if you have done a big incisional hernia surgery where a big amount of gut has gone back into the abdominal cavity, you would like to start the patient on physiotherapy, on chest physiotherapy, and then the discharge planning and the follow up. If you need to schedule a follow up appointment, with whom, any referrals, and when. So, this is a complete daily note which should be written.